Good day, I'm Rajan Dina, and this is our topic. I'll be presenting on physical activity levels. First off, what is physical activity or PA? The WHO has defined physical activity as any body movements that require energy expenditure produced by the skeletal muscles. Examples include badminton and cycling. Physical activity levels, simply put, is used to express one's daily physical activity in numbers, as well as the total amount of energy that they have spent in a day. There are three types of intensities when it comes to physical activity levels. Light are those that are commonly done as part of one's daily routine. They could also be classified as lifestyle activities, ranging from walking around the neighborhood to making the bed. Moderate physical activity levels, on the other hand, involves participating in some form of cardiovascular endurance exercises for 20 minutes to an hour, 3 to 5 days a week. This could include things like strength training and stretching exercises like Pilates. Vigorous refers to exercising for up to 20 to 60 minutes a few times a week, inclusive of things like aerobic exercises, strength training, and interval training. Question is, why is PA so important? PA has been found to combat a number of health issues in both physical and mental health. The WHO has even found that physical inactivity increases the risk of death from 20% to 30% in comparison to those who are sufficiently active. Due to the absence of specific interventions for COVID-19, people had to resort to preventive measures like exercise, physical distancing, and staying at home. PA may reduce the risk of hypertension and non-communicable diseases or NCDs, like diabetes, as those with NCDs are at a higher risk of succumbing to the symptoms of COVID-19. Therefore, prevention and treatment of NCDs could be conducted through the regular participation of physical activity. PA may also reduce the possibility of having depression. It was discovered that low levels of PA have been associated with anxiety and depressive symptoms. Findings of studies done by Puccinelli et al. And Jiang et al. Were found that those with decreased physical activity had high levels of mood disorders and an increase in anxiety and depression levels. This further solidifies the importance of physical activity. What are the risks of a sedentary lifestyle? A sedentary lifestyle can contribute to weight gain and obesity, especially when paired with an unhealthy diet, further increasing the risk of developing certain health issues. It was also discovered by Hammer et al. 2020 that there is a greater risk for hospitalization for COVID-19 due to physical inactivity. As mentioned earlier, in Puccinelli et al. And Zhang et al. Studies, decreased physical activity can contribute to an increase in anxiety and depression levels. Thus, a little movement throughout the day will keep the doctor away. Next, we move on to the impact of COVID-19 on physical activity levels and mental well-being. Firstly, we'll look at it from a national perspective. According to a September 2020 survey done by Ipsos, 56% of Malaysian respondents were found to have done less physical activity while staying at home more, which is higher than the neighboring countries. In terms of doing less than or no PA at all, Malaysia ranked the worst among the neighboring countries like the Philippines, Singapore, and Indonesia. In a similar survey, the mental health well-being of Malaysians were recorded. The Malaysian respondents that were negatively affected were 44%. When it comes to those that were negatively affected emotionally or feeling down, however, Malaysia fared better than its neighbors, ranking the lowest in that category. Next, we'll look at the global perspective. It's kind of a lot, so to sum it all up, all the studies concur that COVID-19, specifically the lockdown, has had a negative impact on both physical activity levels and mental health well-being, whereby lower physical activity levels were associated with lower mental health well-being. Similarly, increased screen time and sedentary lifestyle behaviors like increased sitting time were recorded across adults, young adults, and children alike, such as in Hong Kong, France, and United States. The WHO has recommended a few things that we could do. The most important one, in my opinion, is to check your sitting posture regularly while working from home and to take frequent breaks by getting up from sitting every 30 minutes or so. So in conclusion, there are still many ways that we can do to have some levels of physical activity daily throughout the day. So PA is not only important for our physical well-being, but also our mental health. Like the WHO said, doing any activity around the house is better than none at all. Thank you so much for watching. That's all from me. Let's move on to my next teammate.
My name is Balkis Jim and I'll be explaining nutrition and its impact on individual during the COVID-19 pandemic. First and foremost, what is nutrition? The purpose of nutrition is to provide nourishment, vitamins, and proteins. It is basically an individual choice to their diet, what they consume in their body, that also have a huge impact on their physical health and their mental health. Study also found that a well-balanced, rich of nutrition can actually impact individual mental health. According to health belief model theory, individual perception of nutrition intake and their diet can predict the outcome of the nutrition intake and its effect on their physical and mental health. So basically, when there is lack of knowledge of nutrition intake, people tend to likely to basically have a different perception, to not care much about nutrition intake. Relating with the pandemic, a lot of individual nutrition intake has just going downhill due to one of them being isolated. That has led to nutrition imbalance. Major disruption in health nutrition occurred during this pandemic. It also has affected individuals psychologically, where the pandemic has forced people to change their lifestyle, which has a huge impact on their dietary habits changes. A study that was found in Poland, there's a large number of people that has changed their dietary habits. They now consume a lot more food than usual or before the pandemic. The increases of food consumption and nutritional imbalance during the pandemic occur due to the post-traumatic stress that the COVID-19 pandemic has causes to a lot of people. Leads individuals to change their dietary habits. A lot of anger and confusion were reported, which has led people to experience such an overwhelmed emotion. This overwhelmed emotion has developed a lot of individuals to have these negative habits. Some of them being they start snacking more food. This also has led individuals to have a negative dietary habit. Risky eating disorders that affect the nutritional imbalance during the pandemic occur due to the new lifestyle changes of the pandemic. First of them being binge eating disorders, and second is anorexia nervosa. First, starting with the binge eating disorders. What is binge eating disorders? It's a psychological disorder when individuals consume a lot of food in a short period of time. During the pandemic, a lot of people tend to stock up a lot of food due to the fear of not having enough food, and this has led them to developed eating disorders. This is also part of a coping mechanism, and this has led to the imbalance of nutrition intake. In contrast, we have anorexia nervosa. Anorexia nervosa is a different case which individual under eating. It is also a psychological disorder where people have a distorted perception of their body. So the lack of balance of nutrition and distorted perception of food or to consume more food has affected many individuals during the pandemic. Anorexia nervosa increasing significantly during pandemic. People being isolated, they experience stress, and they're also feeling out of control. This has triggered many individual eating disorders. Eating disorders like anorexia nervosa has affected nutritional imbalance. Ways of controlling nutrition habits and nutrition intake during the pandemic. The first is create a plan. It is very important for individual to create a plan, focus on needed items only, and utilize the items that we already have at home. The second tips is to prioritize fresh foods and understand the ingredients. The reason being is to prioritize fresh foods is that it expires very quickly. It is also always available in the market. And it is also very important to save leftovers in the fridge. First, it lasts longer to avoid waste. The third tips is to create a home-cooked meals that individuals can avoid from overspending. They also are in control of the nutritional balance that they create in their meals. The fourth tips is take the proper portion. It is very important for individual to be cautious with the food portion size. It will help individual to not overeating or over consuming food. The fifth tip is to consume just enough fiber and water. Consume just enough fiber and drinking a lot of water will help individual to help their digestive systems and also to avoid from overeating. And the last tips is to enjoy mealtime and family time. A perfect opportunity for individual to teach their family members, to teach them how to make meals that are rich and have a well balance of nutrition. All in all, to conclude everything, it is very important to take good care of our body, our physical health, our mental health, and consume a well-balanced, rich of nutrition so that we can avoid from various risky diseases and eating disorders. That is all from me. Thank you.
Sleep guidelines during the COVID-19 pandemic. Okay, Firstly, what is chorosomnia? According to Gao and Scullin 2020, chorosomnia is characterized by a spike in sleep disorders as well as anxiety, depression, and stress symptoms during the pandemic. Although insomnia is often associated with anxiety and depression, chorosomnia is distinct from typical insomnia that is connected to the COVID-19 pandemic. What are the symptoms of chorosomnia? It is the difficulty of falling and staying asleep, increase in stress levels, increased symptoms of anxiety and depression, such as intrusive thoughts, delayed sleep schedules, symptoms of sleep deprivation, such as increased daytime sleepiness, poor mood, impaired concentration, and focus. A lot of people are fed up with the COVID-19 pandemic. So what does fed up stands for? It is the financial stress, emotional stress, distance from others, unpredictability, and professional concerns. So what are the difficulties of sleeping in a pandemic? Firstly, it is disturbance in everyday life. It is the anxiety and worry about this pandemic. It is the depression and isolation, excess screen time, greater family and work stress. Okay, why is sleep so crucial in a pandemic? A healthy immune system is aided by sleep. Our body's defenses are strengthened by a good night's sleep. According to Eskerted and Nielsen, studies have shown that certain vaccines are less effective when we don't get enough of it. Sleep improves one's mood. Sleep deprivation makes an individual irritable, sap their energy, and exacerbate or trigger depression. Our brain functions are enhanced by sleep, and our minds perform better when we get enough of it. The complex thought, comprehension, memory, and decision-making all benefit from a good night's sleep. A good night's sleep will help adults and children adjust to work, at school, at home. Sleep is beneficial to one's mental health. A lack of sleep has been attributed to mental health disorders such as anxiety disorder, bipolar disorder, and PTSD. There are two main theories on sleep, which are information and consolation theory and repair restoration theory. Sleep guidelines in a pandemic. We need to practice a good sleep hygiene. So what are the ways to practice a good sleep hygiene? Firstly, we need to prioritize sleep to have an adequate amount of bedtime around 7 to 9 hours. Have a fixed sleep and wake up time. Make gradual changes to your sleep schedule to achieve a consistent sleep schedule. We need to make sure our room is quiet, dark, relaxing, and a comfortable room temperature. We also need to budget few minutes for winding down, which will take 30 minutes to 60 minutes. We need to do something that relaxes us, such as listening to soft music, gentle stretching, reading, and do relaxation exercise like meditation and paced breathing. We need also to get daylight exposure and be physically active on the daily. Getting sunlight is key and in regulating daily sleep patterns. Exercise regularly makes it easier to sleep at night and achieve better quality sleep. There are things we need to avoid to ensure a better quality sleep. The first one would be avoid alcoholic drinks before bed. Alcohol keeps you awake in the middle of the night by keeping you in the lightest stages of sleep. Caffeine's stimulant effect in coffee, colas, and chocolate can take up 5 to 8 hours to wear off completely. Eating large meals and beverages late at night. Indigestion from a big meal keeps you awake at night. If you drink too much water at night, you can wake up often to urinate. And lastly, avoid using your phone in bed. Limit your bed activities to create mental connection between sleep and being in bed.
For the next point, I'll be talking about stress. Stress can be caused by many adversities in life that are perceived as threatening or troubling, especially during the COVID-19 pandemic. The stress people experience are due to threats caused by the COVID-19 pandemic, such as health condition, especially for older people who are more susceptible to getting the disease, they might feel more stressed, and also financial instability, especially for people who are affected by the economic downfall that is caused by the pandemic. If stress is left unmanaged, people can experience loss of focus, fatigue, and also irritability. So during this COVID-19 pandemic, people have experienced a lot of negative experiences leading to stress, such as loss of loved ones, rapid changes in the way of living, disruption of plans, and also disruptions of social relationships. Some of the reported issues accompanied by the pandemic include feeling stressed or overwhelmed, anxiety and extreme worry, increased restlessness, as well as other problems. And a survey by the American Psychological Association showed that nearly 8 in 10 people say that the coronavirus pandemic is a significant source of stress in their life, and also nearly 7 in 10 people reported having experienced increased stress during the pandemic. So now, let's take a look at some of the coping techniques when it comes to stress during the pandemic. Firstly, take breaks from taking in news or stories regarding the COVID-19. Although it is very, very much important to learn about the world, learn about the state of the world, the current state of the world, but learning about it constantly can take a toll on you because you might be continuously hearing negative or upsetting news. So, what you can do is set limits to watching, listening, or reading the news to only a few times a day. Take your mind off of stressful matters and try to focus on something that can help you unwind. For example, watching movies, your comfort movies, spending time with your hobby, or reading a favorite book. Exercise as regularly as possible, even though it's kind of hard to do that in this pandemic because of the lockdown, so you can't go to the gym. So, what you can do is set a workout routine that is suitable in the comfort of your own home. And then, if you have any health related problems, be sure to take measures in getting better, such as seeing the doctor and getting screened, taking medications or vaccinations as advised by a healthcare provider. And then you can talk to someone because sometimes the stress we experience is too heavy to bear alone. So it's best to have a support system, which is someone that we can rely on to vent our feelings to. Not only that, talking with someone you trust about something, about your problems, about your feelings can make you feel heard and understood. Lastly, we need to remember that we are all in this together. The better that you can manage your own stress, the better it is you can do it for other people, for your loved ones especially. Reach out to the people you love, whether it's through call, message, or social media. Provide support for them if possible. This can also help reduce feelings of loneliness and isolation.
Hello, my name is Arisha and I will be presenting accessibility to healthcare. Now, what is healthcare? That is the first thing we must discuss. So, when we think about healthcare, we think about diseases and institutions. How do we cure them? How do we prevent these diseases? What steps should we take? But lately, healthcare institutions have been wanting to shift the focus from diseases and institutions to the needs of the people by implementing primary healthcare, which is a whole of society approach to health and well-being centered on the needs and preferences of individuals, families, and communities by considering their physical, mental, and social well-being. This is by highlighting equity over equality. This is because when we talk about equality, everyone gets the same thing, but unfortunately in this world, not everyone is equal and they don't have the same needs. So, by using equity as a primary focus, healthcare is used by adjusting needs depending on what is needed by every person by providing the appropriate intervention and services. Primary healthcare is meant to push for health systems that are inclusive, accessible, cost-effective, and a way for people to maintain and improve their physical, mental, and social well-being. Now, due to the COVID-19 pandemic, healthcare services have minimized in-person meetups with their patients. This is so they could discourage the spread of the virus and to prioritize patients who have the COVID-19 virus. So a lot of these health checkups have moved to online. But there are certain groups of patients who need these physical checkups, such as pregnant women and cancer patients. Pregnant women require close prenatal care in order to ensure they and their child are both healthy and that the child is growing healthily. Now, if they were at home, they don't really have access to certain machines, such as the ultrasound machine used to track the physical growth of their child. While cancer patients require in person treatments such as immunosuppressive therapy and tumor resection. But these treatments, surgeries, and appointments are canceled, usually. So let's talk about mental health. Mental health has always been a pressing issue that everyone has discussed, especially since everyone is pushed inside and is pretty much stuck. Some people have lost their jobs. While one of these groups that are hit harder than expected are students who have mental health conditions such as autism, ADHD, BPD, and depression. Their motivation, focus, and memory has all tanked due to staying inside for so long. This is because these people with mental health conditions usually lack motivation, focus, and memory to begin with. So they rely on routines and the environment around them in order to push themselves to remember things, to focus on things, and to become more productive and more mentally healthy. So, in relation to mental health, of course, there are online therapy services. They've always existed, but the industry has pretty much boomed due to everyone being stuck inside. Thus, they can't go for in person checkups, and also because it has been such a stressful and uncertain time. So, e therapy has helped people manage their psychological well being. Well, psychologists, they have a few steps that they can use when they admit a patient. At first, they will assess their patient and see what issues they have, what stresses in their life that they have. Then, after that, they provide them with psychoeducation, tell them about what their client might have, and give advice and proper education on what they do have. After that, they will provide emotional support and then provide action strategies in order for their clients to improve their coping skills. That's all from me. Thank you.